Let me introduce our next speaker, Mr. Saranya Sachi Balasubramaniam, who is Principal and Managing Director of Acchutha and Institute of Optometry. He is also an alumnus from Elite School of Optometry and Shankarnath, Chennai. She is going to talk about opportunities in hospital practice. Over to you, ma'am.
Thank you, Gopi.
Your slides are up.
Yeah. So I have just one slide which basically explains the entire hospital practice, because most of the previous speakers have covered most of the things that I wanted to say. So why should you join a hospital? Why should you work in a hospital after you finish your optometry, bachelor's, be it master's or whatever? What can you expect when you join a hospital? What is referral management and counseling, and which kind of a hospital should you really join in? Why join a hospital? I think very simple. If you have completed your optometry, not all of us come out with the ample or the required amount of clinical exposure and knowledge that is required to either run your own independent practice or, go and say that you're able to handle any patient that comes to you. So that being the case, I think it is very important for us to sort of, consolidate all the learnings of the 4 years and start practicing under an umbrella, so to speak, where you're still covered by the hospital. You have seniors over there who would be able to guide and sort of, take you forward in your practice. What can you expect when you join a hospital? Knowledge, first of all. The amount of clinical exposure that you get when you join a hospital is definitely more than what you would get if you join a clinical practice in an optical outlet, where, yes, refraction is important, contact lenses is important, but here in a hospital, ocular diseases, picking up, conditions in the eye, able to counsel the patient, refer the patient, all those kind of things is one important aspect of knowledge, which will be sort of quintessential or very, very important for you to have when you practice on your own. The knowledge doesn't stop with just clinical knowledge. There are other aspects of management that you can absorb directly, indirectly when you join a hospital. The exposure to the kind of patients, the communication skills, and what is expected of a clinician by the patient is also quite visible to us when we join the hospital. Different specialty practices, obviously, like, there are questions in the box which have popped up regarding orthokeratology, specialty contact lenses, binocular vision clinics, low vision clinics. Can we do these independently? Of course, you can do all these independently after doing your bachelor's, but provided you have the adequate knowledge and the exposure that would be sort of be able to allow you to practice as an individual. See, my take on this as a practitioner, I started off, I graduated from ESO and then I started working at Shankarnath. Why did I join Shankarnath? It's not because I felt I didn't have enough exposure, but I felt that I wanted a little bit more sort of, comprehensive knowledge, which would sort of stand good stead when I wanted to start my practice. So my ultimate aim was to start my own practice. So in the process, I went through going and working at Shankarnath, where I had brilliant exposure in almost all the aspects of optometry and ophthalmology, so to speak, and patient handling. Financially, does it really support what you want to do? It's not as bad as it was before. You're still getting paid. It probably may not be as much as what you would be getting paid in the other sectors. But I would think the first 3 years after you graduate, you should concentrate on assimilating and accumulating as much knowledge as you can. I say 3 years, some say 5 years. It depends on what you want. This assimilation of knowledge, there is no price that you can put on it. So I would like to think of it, I convinced myself it was like sort of like an extension of my internship where I was getting paid to learn as well. So what kind of a hospital should you join in? It depends on your ultimate goal. What your ultimate goal is, like if you're thinking in terms of like all what my previous speakers have said, if there is a particular line of work that excites you, if there is a particular line of work that once makes you want to wake up in the morning and get up and go out and do it, then that's what you have to concentrate on. So what rocks my boat is probably clinical practice. So for me, working in a hospital, which gave me a lot of exposure to clinical practice, is what I wanted to do. And that's why I joined the hospitals that I did. I also wanted international exposure. So that's why I went to the UK, practiced in UK for about 6 years before I came back and started my own hospital in my hometown. There is one other thing which I think is very, very important in your ultimate goal. When you join a growing organization like, say, Acchutha, for example, my optometry team here doesn't do just core optometry. The senior optometrists who will be speaking to you further on, one of them does clinical optometry and research. One of them does clinical optometry, community outreach. He sort of works as the academic officer for our entire institutions, both undergraduate and postgraduate optometry, as well as ophthalmology. He and the other optometrist who is in charge of my clinics, both of them work together towards all these certifications and, all these NABH and all the guidelines. So the kind of exposure that you can get in a growing organization, there was a quote that I read recently. When you join an organization or a name brand organization, you are part of the organization as an employee. But it's growing organizations that actually pay you to learn on the job as well. So ultimately, decide on the kind of hospital that you want to join based on your ultimate goal. So this is what I have to say with regards to practice opportunities in the hospital setup. You can, like, for example, at Acchutha, we sort of do independent dispensing, independent patient disposals. But we also work with our ophthalmologists, where if we need them to see the patient, we refer it to them for them to have their, cross consultation before they go out. So you figure out which kind of hospital, visit the hospital, find out what kind of work the optometrists are doing over there, speak to the optometrist, and then you decide what you really want to do. Okay, so all the very best, and thank you so much for listening.